CP. CP is a group of disorders that affects movements, muscle tone, posture, and balance. It is caused by the either abnormal development of brain or damage to the brain due to any of the underlying conditions. The severity and symptoms vary from person to person in CP. No two kids or CP are same in any way. They always have different presentation. Symptoms are symptoms vary from person to person. So let's see some of the symptoms which are present in the cerebral palsy kids. Number 1 is movement disorders. Movement disorders means the simple movement of bending a hand is also difficult for them. Either they will have a muscle weakness, they will have a muscle weakness or atrophy, or there will be involuntary movements. That means that movements will be keep happening, they won't be able to control it. Number 2 is the abnormal muscle tone. The tone of a muscles help in the proper movement of any joints. If tone is either less, it will be very difficult to move, that is hypertonicity, and if it is more, it will cause spasticity, that is hypertonicity. In both the cases, the movement will be disturbed. Number 3 is impaired reflexes. There are many normal reflexes that happens with the babies. For example, Moro reflex. These reflexes help baby to adjust in the new environment as they come out of the womb. But in the cerebral palsy, these reflexes either they can be diminished or they can be exaggerated, that hampers the normal development of a baby. Number next one is motor coordination. Motor coordination means that there are group of various muscles in our body. For example, if we have to bend the hand, we have the flexors which work to bend the hand, but due to impaired coordination this movement will be very difficult for them to perform. Next is balance and posture. Because the reflexes are impaired and the movement, there's impaired movement, the overall posture and balance which a kid will show will be diminished or it will be impaired, and they will have too much tendency to fall. Speech and communication problems. Many of the kids that shows the symptoms of cerebral palsy, they are not able to speak properly because of stiffness, is either stiffness, weakness, or impaired reflexes can be the reason for the speech problems. Seizures are one of the very common symptoms seen in the cerebral palsy kids. Because of the severe brain damage or because of the abnormal development of the brain, there are chances or there are many kids who have seizures. Orthopedic problems. Over the time when they are not able to move, when they are not able to walk, or they are on the bedridden position for a long time, they have, due to sparsity or tonicity, they develop many of the orthopedic problems. Last but not the least is a delayed milestones. Milestone is one of the major changes which we see in growing babies. Like, for example, physical milestones means they are able to turn on the bed, they are able to sit by help independently, they are able to walk with help or independently. These are the milestones through which we see that the baby is developing normal. But with the cerebral palsy kids, there is a delayed milestones, or some of the milestones are just absent in them. And for to see whether your baby is growing normally or have any difficulty, you should know what are the major milestones that a baby should be achieving by this age. Next is the gross and fine motor activities. Both the activities, as the movements are disturbed, there are very less chances of developing fine motor skills by their normal age. It is always delayed in them.